Joining me now is Dr. Greg Nestor, a local physician who has an interesting topic to talk about, something you really wouldn't think is a medical condition. When people are walking around in Florida, we tend to sweat a lot, but there's a subclass of individuals, it doesn't matter what the temperature is. Tell me about this hyperhidrosis.
Okay, hyperhidrosis basically is excessive perspiration. Normally sweating, we use that for our control of our body temperature, but hyperhidrosis is a disorder where you have such excessive, uncontrollable sweating that it's beyond what the body needs for regulation. It's about 50-50, men and women are affected. It can occur at any age.
Body habitus doesn't have much to do with it. In other words, it's not just that happy big person. It can be a thin person, and it's a response that doesn't make sense. The body's kind of confused, right? That's why we call it a disease, right?
Right. It's worse with stress, but no, it doesn't matter. Somebody could be in air conditioning and they're just profuse sweating.
And so you can pick these individuals out. Those are the ones that tend to wear a jacket inside and never really raise their hand for anything. So it has some medical conditions that come along with it. It's not just this embarrassment factor. There's some underlying problems with it too.
Absolutely. When you have primary hyperhidrosis, which is localized usually to the axilla, the armpit, the groin, palms of the hands, soles of the feet, because that's where most of the glands are. Sweat glands are concentrated in those areas. And we don't know exactly what causes it. The etiology, whether you have too many sweat glands, the sweat glands are overactive, sympathetic stimulation may be pronounced. But when you have these kind of conditions where you have all this sweat, you can have infections, tinea, fungal infections, you can have bacterial infections. So it's very debilitating to the patients.
So we talk about these boils underneath the arms that are very painful, and then the secondary infections that we get from that, which can cause the individuals not just to have an embarrassing spot, but they actually get very sick from this.
Exactly.
So old days, we didn't do much about it. We may have poked fun at them and done everything else, or sprayed ourselves underneath it, or taken lots of showers. Wasn't very effective. So what do we do about it nowadays?
Well, the two main treatments, one is Botox, which is where we inject Botox in the axilla, into the armpit, and it blocks the signal from the nerves to the sweat glands, so you block the sweat gland production in that way. You have to have that about twice a year, so it's not permanent, but it does work. Now we have a procedure called Vaser. Vaser is a permanent treatment that we can use where we have ultrasound technology advanced that we use for body contouring. We remove fat from different parts of the person's body where they want it removed. But we can adapt this to the armpit, and it's very successful. The way we do it is we put fluid into the axilla, it numbs it up so they don't feel anything, and then we come in with a Vaser probe, which is an ultrasound. And this ultrasound directs to the superficial layers of the skin where the sweat glands are, and we're actually destroying these sweat glands, and we're liquefying them, liquefying the fat, and then we come back and we suction this fat and this sweat gland tissue out, and it's immediate. These people have about an 80% reduction in their sweat production right after we're done with the procedure. And 90% of the patients, it's a one-time procedure. It's highly effective, it's painless, there's no general anesthesia, just local anesthetic, no downtime, it's extremely safe. It's been life-changing for people.
Wow, that sounds interesting. So challenges of, it's a procedure, obviously it goes on the skin. Downside? What's the downside to it? Anything?
Yeah, there really isn't any downside. It's so safe, the patient's wide awake, it's local. As I said, there's no risk. I mean, it's pretty remarkable. It's really made a difference in a lot of people's lives. I've done this on a number of patients that they're professionals. They tape pads under their arms. They're wrapping themselves. It's very embarrassing. You know, you have stained clothing. Your handshake is wet. The confidence, the social isolation, depression that occurs, and when you do this type of procedure, all of a sudden, they're able to interact with people normally without all this self-conscious sweating.
Awesome. What about, you talked about the axilla, the armpit. Do we do it on the hands and the feet?
It's not done in the hands, the feet, the groin. It's strictly, the Vaser is limited to the armpits, the axilla.
Okay. Is there anything else that they can do? So let's say we get this all dried up, but their hands and their groin and everything else is still. What else can we do with that? Would you recommend the Botox at that point?
Right.
Or would you look at the old classical medication piece?
You can do the medication, but they're just not that effective. A lot of side effects. The Botox works. It's not permanent. You just have to keep doing it.
All right. So it's a regional piece at the moment. Any idea will it expand, or is it just not something we can do in the hands and feet?
Not currently. It works out perfect in the axilla because when you inject this fluid, there's a space there. You can go right in with the Vaser. You can attack the sweat glands. It works nicely. There's no downtime. There's really no pain to it. So the other areas just haven't been looked at.
Okay. Anybody who can't have this done, any specific type of individual, diabetic, hypertensive, heart disease, anyone that would say that's not really a good idea for you?
No, it's a very safe procedure. It's just not going to harm anybody. So there really isn't any limitation.
Cool. So of this process, it's relatively new, right? I mean, you've been doing Vaser for a while. I know that because we've talked to you about Vaser a couple of different times. And this procedure, how long has it been going on? So is it like experimental new, or is this something that's been going on for a while?
There's been studies done on it, and I'd say over the last 3 years, the study's been done, and with the success rate, as I said, about 90%. So it's relatively new, last 3 years, but it's cutting edge. It's what people are doing now for this type of problem.
Perfect. All right, so it can keep us from having medical problems. It obviously helps the embarrassment factor. It makes it so that overall our life's a little better. Do we still sweat afterwards when we have that?
You're going to have normal sweating, so you decrease the sweating by 80%, but there's still sweat glands up behind. So you go from this excessive, uncontrollable sweating to what would be a normal sweat pattern.
So, in other words, long-term in Florida, we're still going to be able to sweat, still be able to cool our bodies.
Absolutely.
So we shouldn't have any major long-term complications from this.
Absolutely.
Perfect. Well, I know there's a large population of these individuals out there. I hope this helps them. And thanks so much for sharing your time with us.
Great. Thanks for having me.